Assessment is a critical component of EMS education, ensuring that students develop the knowledge, critical thinking, and decision-making skills needed for success in the field. However, simply administering tests is just not enough. Effective assessments must be carefully designed, analyzed, and continuously improved to accurately measure student competency. In this session, we'll explore the principles of item writing analysis, focusing on how to create high-quality test questions that align with learning objectives and industry standards. A well-constructed exam should challenge students to think beyond memorization and apply their knowledge in realistic scenarios. But how do we know if our test questions are actually doing the job? Through item analysis, we can evaluate the question's performance, identify poorly functioning items, and refine assessments to ensure validity, reliability, and fairness. We're also going to discuss the pitfalls of relying on paid test banks, which can compromise exam integrity when answers become widely available and limit an educator's ability to modify items for their specific program. By the end of this session, you will have practical strategies to enhance your assessments, improve student outcomes, and maintain control over the quality of your exams. So join me on this item writing analysis as we develop effective assessment tools for the EMS education. For those of you who do not know me, my name is Samantha Grimsley, and I am the Weatherford College Program Director. After this is done, if you would like to reach out for further help or talk about your test items, please see my contact information as listed below. Assessment is foundational to EMS education, but if we're not intentional about how we write and deliver questions, we risk missing the mark, or worse, misjudging our students' abilities. Today we'll look at why writing your own question items matter, how to do it well, and how to set up exams that support learning and test what truly matters. By the end of this session, you'll walk away with strategies to create a stronger, more defensible assessment that reflect your teaching and prepare students for real-world care. The most important concept for EMS educators to grasp is the why factor. Number one, assessment drives competency, not just grades. 2, it aligns with instructions. Remember, not one program is the same, which means exams must reflect what is being taught. 3rd, it identifies knowledge gaps, allowing for more adjusted instruction based on learning needs and objectives for individual students and as a class. 4th, poorly written items means that we're going to see poor measurement outcomes. 5th, commercial test banks often fail to reflect your students' needs and over time become compromised as students share questions. And finally, we must assess critical thinking and critical judgment, and that's not just by memorization. The bottom line is reliable, valid assessments build trust in the quality of an EMS education program. Assessment development is not just about testing, it's about ensuring that EMS students are truly prepared to provide safe, competent patient care in the field. One of the most common questions I get when I speak to other EMS education programs is, where do you get your testing material? And my answer usually catches them off guard. I write them myself. Now let's pause there, because that answer isn't just surprising, it's important. Writing test items is a full-time job in itself. It takes time, patience, and deliberate effort. You can't just throw together a few definitions and call it a test. That's not an assessment, that's recall. If it were easy, you wouldn't be here today. It's about investing your time to learn how to do it and do it better. And here's the truth, even the platforms many people rely on, those paid test banks, often don't provide accurate, validated, or up-to-date questions. They rarely run item analysis or check whether a question is actually measuring what it's supposed to. That's why we need to be intentional. Every question we write must be thoughtful, plausible, and aligned with real-world decision-making. Because our goal isn't to just test knowledge, it's to prepare students for clinical judgment. When designing assessments, one of the most important principles to follow is alignment. Every test question should directly reflect the course's learning objectives and the content standards. This ensures that we're not just testing what's easy to ask, but what's essential for students to know and to do. A good place to start is the objectives of the textbook, along with the National EMS Education Standards. Well-aligned questions reinforce competency-based education by focusing on the knowledge, skills, and behaviors that students are expected to demonstrate. When students are assessed on what they've actually been taught, it builds both fairness and instructional integrity. So here's some considerations. Ensure that in alignment with those course objectives. Each question should be tied to a specific learning objective. If an objective focuses on applying knowledge, the question should be requiring application, not just recall. Avoid teaching to the test. This doesn't mean avoiding test prep altogether, it just means avoiding questions that only measure rote memorization, instead of focusing on assuring a deeper understanding and critical thinking. Ultimately, the goal is to create assessments that are meaningful, valid, and reflective of what the student truly needs to succeed, not just in the classroom, but in real-world practice. When building assessments, it's essential to go beyond just testing recall. To truly evaluate student learning and clinical readiness, we need to cover all levels of the cognitive processing. This is where Bloom's taxonomy provides a powerful tool. Let's walk through how each of those domains can be applied in a clinical education. Knowledge. This is the foundation, pretty much the basic recall of facts. For example, what's the normal respiratory rate for an adult ensures that students have essentially information memorized. Understanding. At this level, students explain concepts in their own words. A question like, describe the pathophysiology of anaphylaxis, checks whether or not they truly grasp the why behind the facts. Application. Here, students apply what they know to real-world scenarios. For instance, a patient presents with labored breathing and wheezing. What intervention should be provided first? Test the ability to act on the knowledge in the clinical setting. Analysis. This involves breaking down the information and recognizing patterns. A good example of this is, given these lung sounds and vital signs, what condition should the provider suspect? This requires interpretation and differential thinking. And lastly, evaluation. At the highest level, students make clinical judgments. A question like, which airway management technique is most appropriate for a patient with facial trauma and an intact gag reflex? This is challenging them to weigh the options and justify their decisions. In the last slide, we explored how Bloom's taxonomy helps us design questions across different cognitive levels, from basic recall to complex clinical judgment. Now let's talk about how to apply that framework in a balanced way when writing test questions. Lower level questions, like those focused on knowledge and understanding, are essential. They help confirm that students have mastered the foundational facts and concepts. For example, knowing the respiratory rate or defining anaphylaxis. But to truly assess clinical readiness, we need to go further, and that's where higher level questions come in. Those that require application, analysis, and evaluation. These often take the form of case-based scenario-driven questions, where students must interpret data, make decisions, and justify their actions. These types of questions mirror the complexity of real-world EMS practice. By balancing both higher and lower level questions, we create assessments that reflect the full range of learning objectives, encourage deeper thinking and clinical reasoning, and provide a fairer, more accurate measure of student competence. This balance is what transforms the test from simple knowledge check into a meaningful tool for evaluating readiness for the field. No matter which learning management system you're using, such as Canvas, Blackboard, or Moodle, there are a variety of tools available to help you build effective test questions. However, things can get a bit more challenging with lower tier LMS platforms, which may only support basic formats like multiple choice or multiple answer. In those cases, creativity becomes essential. It's important to not rely solely on one question type. Over the past year, the National Registry of EMTs has updated its exam format to include more diverse question styles beyond just multiple choice and multiple answer. While not all LMS platforms support these newer formats, there are still ways to simulate them. For example, in Canvas, they don't have the drag and drop option or the option of check box, but it does allow for categorization and matching questions. True-false questions can mimic categorization by offering those binary choices like yes or no or 50-50. Ordering questions can be used to simulate a building list format. When using multiple answer questions, one key takeaway from a webinar by Joe Mistovich that I've currently learned is to clearly specify how many answers should be selected. For instance, if you ask students to select 2 answers, make sure there's 5 options to choose from. If it's select 3, provide 6 options. This helps guide students and aligns them with the best practices. And remember, none of this is a secret. The National Registry of EMTs regularly shares this information through their website and webinars, so it's accessible to everyone. When we talk about assessment item types, it's helpful to think about what each type is really measuring, whether it's knowledge, decision-making, or hands-on skills. In clinical judgment, these items test a student's ability to make sound decisions in complex and ambiguous situations. They require prioritization, recognizing several cues, and applying knowledge in real time. There are two different categories: scenario-based, which focuses on diagnostics, and performance-based, which focuses on assessment and treatment. In scenario-based, we're looking for that clinical reasoning. Students are presented with a patient case and must interpret the information to identify what's going on. It's less about what they would do and more about what they think is happening. When it comes to diagnosis, these ask the students to identify the underlying condition based on the assessment data. They test pattern recognition and clinical reasoning. When it comes to performance-based, these assessments are more aligned with the assessment and treatment. They evaluate a student's ability to perform specific tasks like taking vitals, administering medications, or managing an airway. These are often hands-on or simulation-based and focus on action and execution. When it comes to assessment, we're focusing on the gathering and interpreting of patient data, such as what signs and symptoms are present, what's relevant, and what needs further investigation. When it comes to treatment, these evaluate whether the students can choose the correct intervention or next step in care. They often follow naturally from diagnosis and is critical for testing applied knowledge. Now, on the other scheme of things, when we talk about definition-based, these are your traditional recall questions. They test whether students know key terms, definitions, and foundational facts. While important, they should be balanced with higher order thinking items. By using a mix of these item types, we can better mirror the real-world decision-making process. As we move into the actual process of writing questions, there are a few factors we'll discuss. First is that clear and concise stem. Next would be plausible distractors, having one correct source able to answer, and add in the appropriate level of difficulty, objectives, and relevance to what we are talking about. So let's talk about the stem. The stem is the main part of a test question that asks something specific. So for giving a scenario, asking the last part would be the stem. What is it essential that we are asking the student to do, or obtain, or tell us they know? So an example of this would be, which of the following actions should the paramedic take next? A well-written stem sets the stage for a valid and fair assessment item. So here's a few key principles to keep in mind. Ensure a clear, focused concept or skill. The stem should target a specific learning objective. Avoid trying to assess multiple concepts in one question, as that can confuse students and dilute the purpose. Avoid unnecessary wording or irrelevant details, unless it's intentional. In most cases, extra information can distract from the core question. However, I will sometimes intentionally include additional details in a scenario-based question to see if students can weed through irrelevant information and focus on what's clinically important. This mirrors real-life EMS situations where not every detail is relevant and critical thinking is key. Avoid cues that give away the correct answer, meaning be careful not to unintentionally hint at the right choice through phrasing, grammar, or patterns in your stem, such as, what is the most common cause of hypoglycemia in a diabetic patient? A, stroke, B, infection, C, too much insulin, or D, liver failure. Many students will guess this just by recognizing the word insulin as something that lowers blood sugar, even if they don't fully understand the physiology. Write the stem as a question, not a statement. An open-ended stem like the paramedic should next with a colon is vague and may lead to confusion or multiple interpretations. A closed-ended stem like which of the following should the paramedic perform next is clear and directs the student to choose from a specific option. Closed-ended stems are generally preferred in multiple choice formats because they reduce ambiguity and improve reliability. Using a verb tells students exactly what cognitive action is required, whether it's recalling, identifying, applying, or analyzing. So when we look at prioritizing, we're looking at evaluation or decision making, whereas in application to apply, evaluation is for higher order judgment, next or first is going over sequencing and decision making, and suspect is again another type of application or analysis. We also want to make sure that we're utilizing age appropriateness. A febrile seizure in a 12-year-old is unrealistic. Make sure to use the correct provider type as well. Don't ask for things that are not within the realm of that provider. Now let's look at an example. What should you do for a patient with difficulty breathing? This question is very broad and lacks context, as difficulty breathing could be dozens of different conditions. It's leaving the student unable to provide a proper treatment plan. You means specific to you, not everyone. What I do may be different than what other paramedics do. There's really no clear objective to assess, and it lacks clinical realism even at the lowest level provider. Now, let's take that last question and reword it. So instead, a 56-year-old patient has respiratory distress with wheezing, a respiratory rate of 24, and a history of COPD. The patient is alert and speaking in full sentences. What is the most appropriate initial treatment? This is very clear and focused. It targets a specific clinical decision with an initial treatment. It's scenario-based and provides relevant clinical details such as the age, the symptoms, the history, and the mental status. It has an application level that requires the student to apply knowledge on COPD management in a real-world context. There's no unnecessary cues, the STEM doesn't hit in anything, and it's close-ended, as meaning it's framed as a question with a clear expected response. When it comes to creating effective distractors, our goal should always be clarity, fairness, and alignment with learning objectives and not trying to trick our students. So let's look at a few common pitfalls to avoid. The obvious one is avoid tricking or unrealistic answer choices. If you're talking about respiratory conditions, it would be weird to see an answer choice be about GI. All options should be plausible and relevant to the question. Implausible distractors don't challenge students, they just make the question easier to guess. Avoid all of the above or none of the above. These options often allow students to guess the correct answer through test-taking strategies rather than content knowledge. For example, if two options are clearly correct, all of the above becomes an easy guess. Be cautious with absolutes like always and never. These are rarely true in clinical practice and are typically only appropriate in mathematics or logic-based questions. Savvy students know this and they may eliminate these options without fully understanding the contents. Avoid overlapping distractors, such as 3 to 4 years, 4 to 5 years, 5 to 6 years. Watch for cues in those distractors. Sometimes the correct answer is unintentionally longer, more detailed, and more specific than the distractors. This can signal the right choice to the students who are guessing. And as mentioned earlier, avoid giving away the answer in the STEM. Just like the answer choices, the STEM should be neutral and not contain hints or language that aligns too closely with the correct option. By focusing on clarity and realism and balance, we can write questions that truly assess understanding and not test-taking skills. You should always be able to reference your answer as well. This is an EMT level question written by testing software. I won't say a name, but when I Googled it, the question lit up like a Christmas tree. We'll talk about that here later, but let's dive deeper into this. In the STEM, its focus is on albumin, a lab-based concept that EMTs are not trained to interpret or act on. So on scene, a 43-year-old male states that he has a history of liver failure and does not produce enough protein albumin. Given this condition, which of the findings would you expect? While answer A is technically correct, the question requires background knowledge that is not expected of the EMT level. EMTs don't diagnose liver failure or hypoalbuminemia. They assess presenting signs and symptoms and provide supportive care. The question doesn't ask what the EMT should do, observe, or prioritize. It's more of a medical trivia. With B, we're looking at an infection, and with C, we're talking about hypoxia with bradycardia. These are not directly related to this condition specifically. And when you look at D, it's just confusing. Edema doesn't typically interfere with SpO2 readings unless it's having to do with pulmonary respiratory conditions, which isn't specified here in this question. Now let's look at a different type of question. If the paramedic were to administer nitroglycerin to a patient, what pathophysiological change would they anticipate to occur? This type of question is what we call a parallel pair or a Venn diagram. It has that 50-50 approach very similarly to true-false. By presenting two similarly structured questions that assesses the same concept in a slightly different way, the instructor can confirm whether the student truly understands the material, not just the wording of a single question. In this question, if a student answers one part of the question correctly but misses its other parallel, it might indicate partial understanding or guessing. Now, as you can see in the answer choices, on the yellow, there's just a flip in the increase and decrease, whereas in the green, there is a flip in reducing and raising. Essentially, the same answer is being given 4 different times, with a play in just changing up the yellow and green. For those of you that are not aware, the answer choice to this is C, a decrease in preload and afterload, thus reducing myocardial oxygen demand. Now let's look at another example. A 52-year-old patient has dyspnea and pulmonary edema. The patient reports having a history of 2 heart attacks in the last 6 months. Breath sounds reveal rails in all fields, a pulse of 104, blood pressure of 114/72, a respiratory rate of 22, SpO2 of 92%, and a temperature of 99.1 degrees Fahrenheit. The patient has not urinated in the past 2 days. This is what we call a scenario-based. It provides a realistic clinical picture with relevant history and vital signs. It requires the student to synthesize multiple data points to identify the underlying condition. It aligns with the paramedic scope in that paramedics are trained to recognize and differentiate types of strokes. So let's look at a couple of key findings here. We have dyspnea and pulmonary edema, which suggests fluid overload in the lungs. We have the history of 2 MIs, which indicates significant cardiac damage. Rales in all fields, which is a classic sign of left-sided heart failure. We have the lack of urination for the last 2 days, suggesting poor perfusion to the kidneys. And our vital signs, with a pulse that's tachycardic and a blood pressure that's normal but possibly trending low, and an SpO2 that is showing some mild hypoxia. What happens next becomes the formality of answer choices and the type of style layout. This could easily be turned into different categories of what I'm going to show you that can be done in your LMS settings. Now, utilizing Canvas, taking that exact same scenario from before and using it in a multiple choice, I've asked the paramedic to do one thing. Which of the following types of shock should the paramedic suspect? The answer choices being cardiogenic, anaphylactic, hypovolemic, or septic. As a paramedic, it would do their due diligence to understand that there is nothing pointing to anaphylaxis going on here. There's no vasodilation, the vital signs are not within the realm, the breath sounds don't match, and nothing else shows to be of that category. As far as hypovolemia goes, the vital signs again do not match. Now when it comes to sepsis, this patient isn't really having a fever, nor do the vital signs really indicate anything. However, when we look at cardiogenic shock, we understand that cardiogenic shock can be as a result of having the previous heart attacks in the last 6 months, having congestive heart failure and having rales in all fields, and showing some of the signs and the vital signs, although they're not significant, but also the fact that the patient has not urinated in the past 2 days shows a lack of perfusion. So this is a complex question that again just took a scenario and asked which of the following types of shock should the paramedic suspect. Easy multiple choice. Now taking the exact same scenario again and utilizing it in multiple answer, the student is asked to select 2 answers to which of the following are the appropriate interventions for this patient. Apply oxygen, obtain a 12-lead ECG, deliver a fluid bolus, administer aspirin, or provide a nebulized ipratropium. Realistically, ipratropium has no business in this patient at this time. There's nothing indicating there's mucus secretions that need to be dried up. As far as the administration of aspirin, this patient isn't indicating any kind of cardiovascular compromise. However, when we look at delivering a fluid bolus, vital signs are still relevant to where fluids would not be relevant at this time. Although it is not a contraindication to congestive heart failure, we do have to be a little bit more cautious in those patients, especially ones that have rales. So the correct answers would be to apply oxygen and obtain a 12-lead. If you notice, While it's asking for 2 answers, the student is given 5 different answer choices. That aligns with what we were talking about earlier. Now, to conduct something called a build list or ordering, I've taken that exact same scenario without making any changes. However, in the STEM, I've asked the paramedic to do this. Based on the understanding of compensated cardiogenic shock, place the following clinical findings in the order they would most likely appear as the body attempts to maintain perfusion. So starting off with tachycardia, moving into the lack of urination, then into the respiratory rate increasing, and the mild hypoxia. Essentially, we're looking at the complexity of knowing, can the student recognize perfusion status and what happens when we transition from compensated to decompensated. Utilizing the exact same scenario once again, we've turned this into a matching. So now I've asked the provider to match each patient finding to its most appropriate clinical interpretation. Much of like what I was describing in the first slide when we talked about the example of the scenario, before I even gave you any of the answer choices. We talked about the fact that dyspnea and pulmonary edema indicates the fact that there is a suggestion of fluid overload in the lungs. When we talk about the history of a myocardial infarction, this could be an indication of significant cardiac damage. When we're looking at Rales and all lung fields, this again is a classic sign of left-sided heart failure. Narrow urination for the last 2 days suggests poor perfusion to the kidneys, and with the vital signs, the mild hypoxia could indicate a possible compensated shock. Instead of writing a Venn diagram type question, you could utilize true-false and change up the same scenario to end with this. These findings are consistent with compensated cardiogenic shock as the body maintains perfusion through increased heart and respiratory rates before a drop in blood pressure or urine output occurs. True or false? Essentially, we're asking the student to dig deeper into the pathophysiology of the perfusion status based off the scenario. Now let's look at another situation where we utilize stimulus for clinical judgment. This is very much like those new type of questions we're seeing on the National Registry, where the students are asked to give details about being en route, on scene, and post scene. So in this situation, I'm picking up from the scene. Upon arrival to the residence, the crew determines the patient to live in a well-kept home. Family greets the EMS crew at the door alongside the fire department. The family states that the patient has been having shortness of breath for the last few days, but it continues to get worse. Upon entering the patient's bedroom, EMS finds a 60-kilogram patient sitting upright on the edge of the bed, awake and tracking the crew's movements. Based on the provided information, place and order the proper steps for conducting a primary assessment. This is one of the #1 places I see students failing and why they can't successfully understand what's going on with the patients. It's because they don't understand that test questions are not complex enough to be everybody is doing something, and that is asking a linear type of thing. So when you look at a primary assessment and realizing and you're reading these types of questions, if you haven't already noticed, the general impression was in the actual notes of the call. So it allows them to bypass the general impression and go straight into, and again, it's an ordering process. However, I understand the order is not completely correct on the screen right now because it's on shuffle. So technically, determining mental status and responsiveness would be #1. #2 would be determining chief complaint. #3 would be assessing airway patency. #4 would be assessing adequate ventilatory status. And #5 would be assessing circulation, followed up by identifying transport priority. It follows along just as you would see in a skill sheet. Now we go on to utilize that same scenario we've been using and asking this paramedic provider to categorize. So the STEM on this is, based on the patient findings, categorize what is the 2 most probable medical emergencies and the 2 most appropriate treatments for this emergency. So most probable causes, is it chronic bronchitis? Is it congestive heart failure? Is it an NSTEMI or cardiogenic shock? My suggestion would be putting congestive heart failure and cardiogenic shock. For most appropriate treatment, we saw these same answer choices back in ordering. So once again, obtaining a 12 lead and applying oxygen would be the correct answer. Online exams invite cheating, so I caution you with those. In-person exams improve validity. When we are designing exams, keep readability and structure in mind. And remember, no system is cheat-proof, but in-person exams add layers of integrity. Exam design in the physical and digital setting can impact performance and honesty. Simulate the National Registry environment while supporting student focus and confidence. Setting time limits to mirror that of the National Registry allows for pacing. One question at a time reduces that overwhelmingness and improves focus while building confidence in first responses. It prevents the second guessing and aligns with that same standardization that we see in the National Registry formatting. Shuffle your questions and answers. This encourages critical thinking, especially when you're in an in-person exam and students can see computers in front of them. It also allows for a reduction in memorization so that somebody can call and share their results or share the questions with somebody else. By setting these types of settings, this will help students build familiarity with the National Registry format and reduce cognitive overload and promote a calm and focused test-taking environment. Remember that test question that I said from earlier on that lit up like a Christmas tree? Well, here it is again. I took the exact same question and put it into Google. And what do you know? Immediately Quizlet and Brainly came up. It was right there, word for word, with the answer choice. That's where I say that test invalidity comes into play when you utilize software companies. Nonetheless, if you were looking at this test question and you wanted to rewrite it, would the manufacturer let you? That's a question you have to ask yourself. I'd also like to know, what's the statistics behind it? How many times has this test question been ran? How many times has it gotten correct? How many times was it correct earlier on versus now when people are Googling it? All things you should be thinking about when you're paying for your test banks. Now take that same scenario that we reworked in multiple different formats in the LMS setting. Nothing comes up. Nothing of the sort, even flags to be similar. I challenge you as you're writing your own questions, if something doesn't seem right or seems off, throw it through Google and see what happens. If you can't validate it or you feel like your validation skills are off, again, Google it. I would rather know that my test question is online so I can rewrite it than be giving out a bad test question that I can't provide any backing on. Your testing strategy should be intentional and not excessive. Low-stakes assessments provide frequent feedback and help students build confidence, whereas high-stake exams should measure mastery and decision-making. We won't want to over-test these students. That just adds stress and reduces meaning. Instead, match your exam style and frequency to your course's goals and complexity. A thoughtful balance of question types, recall, and decision-making better reflects the real-world EMS demands and helps us to evaluate true readiness. Think about where you want to set your pass rate at. Do you want any retests, and what will that retest be? Do you want it to be of a comparable test or the same test? These are all plausible questions that you need to think about as you're writing test questions. Now, as you finish up with writing test questions, there's an important factor to that, and it might be bringing us to a part 2 of this series, but that's the item analysis and refinement. You have to be able to analyze the results for the question quality, adjusting the items based on the data, and building and maintaining a strong test bank. This is going to allow for that closing of the loop with instruction. How do you know that you wrote a valid test question if you don't go back and see if it's actually being answered to the means that you wanted it to be? Also, you get to get a vibe of how complex that test question is in the student's eyes. Just a recap. Make sure you're writing with intent and alignment. Avoid the overuse of one style or reused exams. Integrate them into your LMS strategically and create a student-focused environment that reflects the clinical readiness, because above all, we want to make sure that our students are doing right by their patients through us as education programs. And it all starts with the assessment value of what we do. If you have any further questions that weren't answered here, I'd be more than happy to help you. Please send me an email or by all means call me. This is a process that never stops going, so take advantage of it. And if you're interested in a part 2 on how to run analytics on your test questions, please let me know. I'd be happy to draft up a presentation. Thank you for joining me.